arthroplasty is just a medical term for an artificial joint replacement. Typically, the most common joints that are replaced are going to be your hip, knee, and shoulder. We essentially will replace a damaged or worn out joint to improve its overall function. One of the ways that you could prepare is making sure that your, all your health conditions are well controlled, whether it be your blood pressure or your, glucose control for your diabetes, and then just your overall health in terms of your weight, maybe doing physical therapy. Sometimes we have patients do physical therapy prior to surgery in order to increase their strength and their overall endurance, and that makes them a better candidate for outpatient shoulder joints. Patients often will come in and say, when is the right time for me to have knee surgery? And typically the way I describe it to them is when the pain starts to affect your activities of daily living. So if you would normally be someone that would garden, go to church, go shopping, you no longer do those things because you go, well, you know what, I'm going to go shopping, but by the time I reach the front door of the parking lot, my hip is going to be bothering me and I'm not going to enjoy it, so I'm just going to stop doing that. So there's no point in doing those things because after joint replacement, you'd be able to go back to all those type of activities and enjoy them. When I tell patients, you need to do something more because once you have your hip, knee replaced, you're able to return back to those activities without any problems. Each joint is different in terms of longevity. So hip replacements tend to last the longest out of all the joint replacements. Probably 20 plus years you can expect from a hip replacement. Knee replacement is probably going to be more in the 15 to 20 year range. Shoulder replacement is going to be similar to the knee, maybe in that 12 to 15 year range. The older you get it too, you're not as active, so it's kind of like your car. If you're driving it, 20,000 miles a year versus, 5,000 miles a year, it's just going to last longer. So the younger patients that's one of the reasons we don't like to do them on younger people. One, we know it's not going to last forever, and two, they're just so much more active that they're going to wear it out faster. So you can stay as active, you just have to modify the way you do your activity in terms of doing lower impact exercise. So instead of running or even walking is better than running, but a better thing would be a bike or a lifto machine or swimming or water aerobics, because that's going to put very little stress on your joints. So in terms of physical therapy after joint replacement surgery, hip replacement probably requires the least amount. Oftentimes patients will do a short course of outpatient or sometimes even home therapy. A lot of the home therapy patients will do that for the first 2 to 3 weeks, and oftentimes they don't require any additional therapy other than that. Knee replacement patients typically will require therapy slightly longer because you not only with hip replacement, you just have to get up and walk, and you have some motion in your hips, some strength, but pretty much it's just getting up in the motion of walking. Knee replacement, you have to walk, but you also have to get your flexion and extension back with your knee, so it takes a little bit longer. And those patients typically do therapy probably more like 6 to 8 weeks. It's not hard at all to make an appointment to see a physician at EmergeOrtho. You can actually self-refer. Most insurances allow you to do that. You can just call us. We'd be happy to see you to evaluate your joint and kind of talk about a plan for you to get you feeling better and get you moving.